Hi guys, I'm Dr. Prashanth, Doctoratorial's Medical Gastroenterology faculty, and we are currently on 12th of December 2012. And today evening we got a great news about the Indian chess champion Gukesh. So on the same time, we had amazing news about few of our students performing really well in the INES's October 24 session, and the results came just today. So here we have Dr. Navsheen Singhal, who has scored AML score rank of 3 and CML rank of 3. Congratulations, Dr. Navsheen. It gives me great pleasure to have you here. And these are like dream ranks. So rank 3 means obviously you're going to get the top institute in the gastroenterology. So how are you feeling?
Hi, sir. Good evening. Thanks for having me, sir. Glad to be here. Thanks a lot to you and your team, sir, for helping me be here, sir. And obviously, sir, it's a great feeling to have achieved this because that's what we have been preparing for quite a long time. Probably dreaming of this throughout our MD. What next? So this is my next, sir. So really
Single
glad,
digit
sir.
rank. Single digit rank,
Yes, sir.
first attempt. So tell me
Yes.
where it started. Where are you from? Where did you do your UG, PG? All your stories. The podium is yours.
Okay, sir. So, sir, I'm basically from Haryana, sir, Hisar city. So, I did my UG 2015 batch from AIMS Delhi. Then I did my MD from PGI Chandigarh 2021 batch. And now, hopefully, Gastro again back to AIMS Delhi, sir. Hopefully. Yeah.
Great. Yeah, of course. Rank 3, there are 4 seats. Even if you had got rank 4, also, you would be getting the same place which you're dreaming of. So, great, man. Congratulations once again. So, AIMS Delhi is the place which you're going to choose. Quite obvious. And why gastro of all the branches? You decided it in MD or MBBS or much longer?
So I had an inclination definitely for gastroenterology from my MBBS days, sir. Starting from
Oh,
the like we had great lecturers in gastro, sir. So we used to enjoy it a lot. Then I would really thank my institute for giving me the platform to actually experience the subject as what it is supposed to be. I have rotated for around 3 months in hepatology during my MD days, and then another 2 months in gastroenterology per se. So out of my 36 months, 5 months I was in gastro, and really that was probably the best days. Like I
wow.
used to work in ward up till late, 12 a.m., 2 a.m. I did not care. And like gastro was the only posting where I never felt what is the time, what am I doing?
Ah,
Like every moment of it, I really enjoyed. The faculty, the zeal with which gastroenterologists work, the way they are in the endoscopy suite, the way they have to manage the patient because they kind of it has a blend of both theoretical knowledge as well as a interventional. So like it gives me a dream to pack up my day. Like for some days I'll be probably in outpatient and inpatient, and some days I'll also have something interventional to just have a mix in my schedule. So that was the most lucrative
absolutely.
thing from me.
Great, man. So deciding about gastro quite long back in your career journey really makes a lot of difference. And when you're in the right place and see, and you just didn't know about how the time is going. So that's again some of the
Yes, sir.
signs to tell that this is the branch, isn't it?
Probably the France I want. Yes, sir.
Great, great. Very nice. So, uh, see, I'm feeling very happy. So, really, really happy for you. And this is a congratulations from our entire team for you to have scored and got this great result of what you have got. So, I would want to take all the crisp information from you and give it on to the next set of students who are going to give this dream exam, because many people dream of what you have achieved now. Your MBBS is from AIMS Delhi, so you must be generally a good student to have gotten there to crack those exams then. And then PGET and Chandigarh, where you have done your MD. Again, good exposure, lot of workload, and again, you got your passion from there. And now, how long did you, what's the gap, the time that you got to prepare? And then what was your strategy for your theory? And then I'll just go on to the interview round. So first we want to ask you, how much time did you have from your exams? Did you start preparing for your MD days or after your MD exams? And we just want to know how you prepare for your theory exams.
Okay. So basically, for this SS exam specifically, I had studied for around 2 months, and I started 2 months prior to this exam date. So my MD exams got over in around April, and for 3 to 4 months, like I was kind of not sure what to do. I had some doubts in my own mind. I was just started reading something about SS, but then in retrospect, I feel I hardly read anything during the first 2 or 3 months. So the proper dedicated serious study time was around 2 months at the max, sir.
Man,
And
2 months and rank three. Oh my goodness. Okay, go on, go on. Sorry to interrupt.
yes, sir. So that was my study duration, sir. Yes, to add to it, I would like to tell that like during my MD, I had a pretty great exposure of both gastroenterology and hepatology. Our rounds used to be pretty academic, and we used to cover a lot of things that I was reading during the exam. So a lot of it, especially in hepatology, did not feel new to me, I'll be honest. So it's not really like I was blank in my knowledge. And not only we did discuss that academically, I also had pretty good exposure in emergency as well as the wards. So probably that did help me, not probably, definitely that did help me. And so, like, the takeaway message should not be that 2 months are enough, but I had a pretty good understanding of a lot of core subjects of the subject, especially hepatology, prior to starting my preparation. Coming to gastroenterology, sir, a lot of things I feel in what we read in gastroenterology as a MD internal medicine student, we don't actually do that in medicine OPD or in our medicine wards. That is gastro felt like a totally different ball game to me. But I had a pretty good exposure in gastro wards and emergencies. So the core topics which I realized they asked in interview especially, and some of the core questions they asked in theory exams also, they are, a lot of it is from the emergency part, which MD
Emergency.
internal medicine students should know. So those parts, I think I had a pretty good understanding about those. And the rest of it, yes, we have been reading about these topics from, I think, our MBBS days. So IBD and all those things, diarrhea. So yeah, we obviously, all of us have a good idea about those topics. It's just about consolidating it for the exam. So that pretty much took me 2 months.
Great. So, in this 2 months, how did you split the time? What did you do? Was it Schlesinger that you read, or was it some question bank or videos, ISG? There's so many options in front of you. How did you even go through the entire process? At least for the theory. Then we'll go for the interview round. Yes.
Yes. So for the theory, so my first aim was to just complete my watch the videos, like the online tutorial videos, to just get an idea about about each topic, what it comprises. And I knew that I am giving it 2 months for this exam, so I knew that I don't have to scatter here and there about my preparation. I'll stuck to the videos, made my notes, and my goal initially was just to just revise those notes as much as I could, maybe 2 times, maybe 3 times, because in my mind I was pretty sure that whatever I'll be able to score, whatever I'll be able to read, the maximum output would be from my notes only. That I was pretty clear from day one, sir. So I focused mainly on that. So I divided approximately 10 to 12 days for covering my gastroenterology stuff, and another I hope like within 7 to 10 days I'll be able to cover the hepatology stuff. And that pace was like pretty comfortable, I felt at the time when I started. So when I started doing those videos, what I started to realize was that probably not the video or just reading the notes was not, just I had a lot of questions in my mind, like what exactly does this mean? What exactly, why this, why that? So obviously notes are for the last moment crispness, but we have to go a little bit here and there to just understand it for our own benefit. So then I started referencing Schlesinger. I did not read Schlesinger word to word, but I did reference it for almost all the videos that I used to go. I just opened the chapter once. I used to look at the size of the chapter first of all. I used to look at the diagrams, what all are there. So I kind of, and I just read the headings, that at least I know what are the headings and what should be expected from this topic. Then after I read my notes, went through my video, then I used to go to Schlesinger, and if there was a paragraph or a photo or a heading which is like that is totally new to me, so at that time I did used to go through that, just reference it, that just for the sake of completion. Second, there were some important topics in notes and videos which I felt that they are not, I want to know a little more about them, that just so that I'm able to remember what's in the notes, not to add anything additional, just to know to have a better understanding of the notes. So then I used to read those, a couple of 2 or 3 paragraphs from each chapter, whichever I felt like, and they were pretty helpful to me. Again, just to remember what's in the notes and not to jot down extra things or any other thing like that. Then when I read Schlesinger or the notes in every topic, I kind of tried to make it a point that whatever fancy, catchy or buzzword things are there, whatever updates are there, what they are talking about, like uh, this new consensus or that new consensus, whatever they have come up with, I used to try to go to Google and just enter that name, and not even text, just Google image, look at the summary if it is available, or go to the article, just look at the key points, what are the take home messages, because uh like nobody can have 100% strike rate, like you read this point, maybe exam can ask anything. So I just wanted to have a clear picture of why we are talking about this point. So that's why I used to just read the background of the article, why we are talking about it, and what are the conclusions or the recommendations from their side. Not
So,
that was not the case in all the topics, but yes, some of the topics, major topics, which the students, like everyone would realize whenever they are reading. Like if I'm talking about esophageal cancer, obviously I don't think I would go into so much of details in that topic. But if I'm talking about GRD, which I'm probably going to be seeing every day, so for that
mm,
topic I would refer to something additional. So that was my strategies for my first read, sir. So I
okay.
completed my first reading, including these additional some of the additional sources referencing Schlesinger, in 20 to 25 days, approximately that time, sir. Then I had two options, like start with the revision of the topic. I had to try some questions, so I had to do some questions. And third was that I had to watch videos, ISG videos I wanted to try, because during my first reading I did go through some of the videos, and I had some watched some videos in my MD days, so I knew they were pretty good videos. I had to watch them, but it was the time thing that I had to fit in. I had to squeeze in those videos. So after my first reading, I started my revision. From the next day onwards, I just started my revision, and with the revision I started to do my Q bank. So I just used a doc Q bank, sir. First I used to do the Q bank, and then used to revise my topic. So that gave me it helped me check whatever memory I have about the topic that I read 20 days back. Then it also helped me analyze the question. It was not just like reading a fresh, and doing the question was basically rote memory based. So it helped me check if I'm able to analyze the situation, and then it helped me know that how much time I have to spend on this topic to revise. So
Okay.
I'll be frank, the second revision is going to take time. It is, again, I felt like it's probably going to be 50-60% of the first reading. It was not so. It almost took the same amount of time. So my second reading almost went up till 4 or 5 days just prior to this exam. I'll be frank
Oh,
about that. But I was mixing ISG videos along with that. I was mixing this docubank along with that.
Cuban.
So
Okay.
for revision, sir, the most helpful thing definitely was QBank for me, because otherwise the syllabus in itself is too large, and I don't think it is possible to remember each and everything or each and every aspect of it. The QBank basically was the goal was to at least remember all the important stuff that is in the syllabus. And secondly, because I knew that I had not gone reading Schlesinger cover to cover, so there were a lot of things in QBank. I would say 30 or 40% questions were from Schlesinger, which I did not know at all. Even
Mm,
after referencing, I did not know. So that was a big, help for me. That I was confident that rather than spending time on Schlesinger, reading it again and again, I should rather go to QBank and take the high yield stuff, because to me this exam is all about knowing more high yield stuff than knowing all these stuff. Nobody,
correct.
I haven't
That's
really
very
seen anyone.
important. This is very important line that you have told for students. In nutshell, what Dr. Navsheen is telling is, it's not about how much width of things you know. It's about high yield topics that you know, because most of the time these are the topics which is well researched, and the questions will be based on these high yield topics. Okay, so that's the important point that we should take. Second question to you, Dr. Navsheen. How about past year questions? Were the discussions helpful? The past year question, was there any repeat? Did that approach help a little? What was your idea about the past year questions?
Yes, sir. So there's no doubt about it that we have to do previous year questions, because
Okay.
there are so many repeats. Like there is no point even counting. Like it is
Correct.
the single greatest resource, I would say. I think that is a blessing from him, that they are, repeating their questions. So that is great. So especially for the medicine part, because after I did my MD exams, I kind of did not read medicine at all. It was just, reading two or three important topics, but what is two or three topics in the whole medicine. So I was basically focused on gastro. So my whole MD, medicine preparation of the 30 questions out of 80 was totally based on previous year questions and just reading the allied topics with those questions. So that during my first reading of the revisions, I did not do previous year questions, because I had kept them for the last, because I had to do two or three times the previous year questions. I wanted to fit them as close to the exam that it is possible, because you know even if I don't understand the question, I wanted to be sure that I just know I have a rote memory of this question, and the answer which most of the people are probably the teachers are guessing, if it comes, I'll just take that. I was pretty sure about that thing, so I didn't want to spend too much time on those researching about the previous year questions. For me, it was knowing the topics first of all, what they're asking, so that I was pretty confident that whatever I have been using the like dog groups. So everyone, you pretty much covered the previous year questions in any ways, so I
Correct.
was sure that it won't be much of a trouble for me to realizing 4 days before the exam that there are 100 new topics that I have to read. I was pretty sure about that won't happen. It is just how they're asking the question about the same topic and what new updates are they trying to ask, and stuff like that. So I started doing this previous year questions around 10 days prior to this examination, sir. And for me, the source was the recorded lectures, sir, that you had uploaded in the doc app, sir. I used to open around 9 or 10 p.m. after doing everything what I want to do for the day. Then for around 1.5 to 2 hours, I used to just watch those videos, jot down some of the points, and those were my high yield points that I made sure that these 15-20 points from each video I have to read on the day, on the morning of the exam. And I did that. Literally did that, because I
Superb.
was hoping, because a lot of questions are going to be coming from that. And
Okay.
I did gastro questions separately and medicine questions separately. So I did them 2 to 3 times in a span of around 10 days. And I used to again and again go through those. They were asking about drugs, they were asking about some mechanisms or stuff like that, which we don't read that much. So I used to again and again revise that this is for the listeners. Like, I would like to say that these questions would be that no ranker ever leaves these questions, and these like losing out on these questions which have already been asked is a really troubleful thing for you. Like, you
Yeah.
have to know these things, because new questions nobody knows, but this is something you have to know. You don't have a
Yes.
choice in that.
So the second
So
most important thing Dr. Navsheen is telling us is, see, some of the students, I think a significant proportion of students who study a lot aren't able to change their strategy in each day. You see how beautifully Dr. Navsheen went through some videos, made some good notes from the Schlesinger, didn't go through all the book but high yield points, and then set some time on that day night to go through the past year question videos, and then took crisp points from that and again kept it for revising just before days before the exam. So that is called strategizing. You can't just keep a Schlesinger full book, read once and then second time full book. That's not going to help. Your day should be split between different things that you do, that way mind doesn't get bored, it starts thinking. So each question you answer, each topic you see differently, from Q bank differently, then past year questions differently, Schlesinger some data is different. So you actually start getting more of this dopamine hits when you do different things. If you do the same monotonous thing, then that's not going to really help. So this is an important neurophysiology that you're actually have lively done and gotten a rank. That's important point to be taken from you. Amazing. So the last most important thing is, see, we do everything, prepare everything, but then our knowledge should get translated into a consolidated, confident, clear answer in the interview. So what did you do for that?
yes, sir. So, sir, interviews are basically, first of all, I asked all my seniors that I knew who had previously given this exam, previously cleared this exam, to what sort of questions are they going for. And one thing that all of them were saying was that they were not asking at all the factual stuff. They are just focused on the concepts, how you understand the situation. They do not want to know high end differentials. They do not want to know core gastroenterology advances or the core gastroenterology concepts. They want to check how you as a MD internal medicine student are able to understand the basic concepts of gastro, that we probably will have to refine our knowledge a lot in the next degree, but basic understanding, that is all they will be testing. So I did not go for anything high end after my theory exam for my interview. So first of all, yes, I did talk to my seniors. I kind of made a list of, some of the topics that in my mind, that whatever they had told me, what they had been asked. So some in like the pattern of interview has been changing from the last 3 to 4 years. Sir, you must know better than me on how questions have changed. So I wasn't really sure what to do or what not to. So I tried to do as much as I could, whatever topics they told me. And that thing I was sure they were asking emergencies a lot. And like for each student would be asked one or two emergencies. And I personally had seen a lot of emergencies in my MD days. So approaching those patients did not feel like a big burden to me for my interview, because I knew they will be asking the real clinical situation, and we have gone through that. Everyone has gone through that. So I just used to read the topics which I knew they would be asking in the interview about that. For example, I knew cholangitis. So we all know a set of 8 or 10 questions that they will ask in cholangitis, and I only read those topics for my interview and not going through any high end details or anything like that. I know
Mm.
that what they will be asking. So this was my first outline in my mind what I had to do next, but still I was not really sure what exactly they are asking. So then I went on the first day itself, when the prelim round result was announced. It was around 5th of November. So that day itself I watched your first video, which you had already recorded from the October 23 session of mock interview that you had uploaded on a doc app. So I went through that. So that was around a 2.5 hour session. So you beautifully covered everything from, you started with dysphagia, went to all the topics of luminal, then you carcinoma, then you went to hepatology, and you listed out probably, I'm pretty sure, 35 or 40 important topics from gastroenterology. And I'm pretty sure, like for me, 70 to 80% topics that they asked were from those topics only. So I had made a list of those topics that you had told, that, and combined a little 2 or 3 more topics which my seniors had told. So that was my basic thing what I had to do for interview. The types of questions, again, you had already beautifully covered in your video, what students had told you and what I knew what to expect. The only thing was that after October 23, the pattern of interview had changed last year. So for that, obviously, nobody can prepare me. Then you did your next session, the live session, which we attended, the interview session. So you clarified a lot of things on as to how the interview would be conducted, how the questions were again asked, and you were using those WhatsApp screenshots. So it added confidence that okay, this really was the question that was asked. Otherwise, so student always feels okay, he is telling the concept what would be asked, but seeing the WhatsApp was like, okay, this was exactly what was asked. So I stuck to whatever you had told, and a lot of it was again same to same asked to me, I feel, in my interview, sir. So reading, for now, how to cover those topics, sir, I started from one topic, and now this time I wanted to read the topics with a clinical sense and not a theoretical sense. Like if I'm talking about esophageal cancer, I'm talking about achalasia, I'm talking about GRD. I know they will not start with, they won't, ask me to start with GRD. They will give me a case of dysphagia or a regurgitation or something, a combination of that. So all I did was go through the approaches. That is it. I did go through the approaches, and then just finding the right 2 or 3 words that they probably would be coming up with to, give me a clue about the differential, and then they will go jump into the topic. So for example, I was asked dysphagia, and when I was preparing for dysphagia, I prepared the same way. When they will prepare the flowchart esophageal versus what I know, the upper esophageal, then whether it is weight loss or significant weight loss, in what is the duration, what the stuff that we all know. So I actually practice in front of a mirror as to how I will speak if they ask me the approach. If they give me a patient with dysphagia and they just start asking me, how will you approach? So just whatever we read in Harrison's, whatever we read in Schlesinger, the approaches that are given, I try to, formulate in my own words what I'll be able to speak. And my advice would to keep it very, very simple. They do not expect any hi-fi stuff. Very, very, very basic, but clear and contrasting stuff that I'm able to, tease out the diagnosis from the differentials that they'll be giving me. So that was basically my strategy. And uh, I don't think I did anything, too much for the interview, because they'll ask questions which, uh, test your IQ rather than your theoretical knowledge. And one thing I'd like to add, a lot of people had told me that they'll be asking radiological questions also, and which, yeah, they did ask. They did ask a lot of radiological questions, liver as well questions, or whatever, or the frequently asked question, nothing out of the blue. And
Nothing
then
out of the
yeah, and then third was statistics. So they had a very structured interview, which obviously all our seniors and you had already told us that this will be asked, and that was what exactly was asked, sir. So statistics part I would like to press upon, because uh, I did not expect so many statistical questions. There were three rooms, and in every room I was probably asked two or three statistical questions towards the end of my interview. So yeah, that part, some people might miss out on, because they do not ask very simple statistical questions. They will ask something on the top, like you really need to have a basic understanding of statistics. They will not ask mean, median, mode. That is for the theory. They will ask the interpretation of the graphs. They will ask you how will you decide, what will be your decision based on the information that we are giving you from this graph. So that will probably require a little bit of better knowledge, as compared to just theoretically solving those MCQ about statistics. So that
correct.
was my preparation, sir.
Superb. In nutshell, you have told such wonderful tips while you're actually telling the preparation for interview also. One, of course, the students who have already given the exams, the questions that they had asked, and we had job. See, with now we have experience of like handling last 4 to 5 years of students and how the questions, the patterns were changing, and this time the live session was different, where I did have good number of students who had given me, so this was the question. So if I tell this they will ask, this they will ask, people will think that I am making it up. But when I actually showed you, dude, this is the WhatsApp message
Exactly.
sent by my close student, this is exactly asked. So the
Yes.
impact was so good this time by student, that when they were telling me that fine, this really worked out for high rankers like you, very good, impactful. So it's my pleasure that in the interview round, definitely the discussion, and if say almost say 60 people got selected for the interview, and we literally almost had 45 students in the group, so we really knew how everybody have air, and how see, most of us have similar knowledge. It's just about little changes in our consolidation, our clarity of thoughts, and how we speak it out. And important thing is the mirror technique that you have told, which I really have to take down from you, where you have actually predicted that this is the topic, and there will be set of 7 8 questions that they are going to talk, and how I am going to formulate it and tell the answer. Now that is a trick that the student should take it from you. That's the best point from you, that talk it in front of the mirror. Because actually when I'm talking in front of you, I'm seeing my photo also, right? I'm going to see the interviewer's photo also, the videos going on. So you should get used to this mirror phenomenon, and not get suddenly out of this thing. So get
Yes, sir.
used to the actual situation, get used to talking between the computers like this, or the mirror, where you're actually seeing your own face and 2 3 other faces, and you're confidently able to consolidate and talk things which make sense. So beautiful points, Dr. Navsheen. Do you still think there are some important points that must be added for the students, or these points should suffice?
I think I tried to cover a lot of it. Uh, but a couple of points that I would like to, just
Please go ahead. Yes.
bring it out. For everyone who's preparing for the exams, I would recommend you to try to keep the preparation short and crisp. Like, don't spend too much time, because luckily for us, the syllabus for gastroenterology is not that big. It does look big in the starting, but it really is not that big. And we have very few core vast topics, and then a lot of small topics. So a small topic should be done like a small topic only. Like, we don't have to research about the topic. We don't have to go into unnecessary articles on PubMed or whatnot to just keep on knowing and knowing about those topics, because they are this like aims not just in SS exam. They have a habit of focusing on topics. They focus on some topics and very particular areas in each topic also, and they will keep on testing you on those similar topics only. They have been doing so for the past couple of years. They will continue to do so. Yes, at times they do introduce some new topics, but I don't think that is a game breaker for any of the students. Nobody does that, and none
New
of the
for
people.
everybody. That
So it is new for everyone, so do not focus on that. Do not spend too much time on the advances. You should know the advances. Like, try to keep up. Just go through the headings of any gm, whatever they are they have a weekly update. So just go through the gastroenterology section, so you'll know what all they're talking about. And if you go through the previous year questions, whatever drugs that they have actually asked, it was in the previous 6 months that there was an NEGM article or a JAMA article on that, and then that they have asked. Now it won't be, really practical to cover all the articles, but yes, to have a good sense about what's new in the field. And
Yes.
whatever new in the field is, they ask only about, the gist of it. You are not supposed to spend your 1 or 2 days, researching about that topic. Don't do that. But yes, stay updated first of all. Second, for the drugs, the drug part, I was repeatedly seeing in the previous year question that they were again and again asking drugs. To me, it felt like it is a question that I can crack. It'll take probably 1 or 2 hours of my schedule to, go through all those 2 or 3 years of NEGM headings. It has a very nice filter. NEGM website has a filter. You can just put in gastro. You can sort out all the articles, and I made a list of, all the drugs, whatever it is coming, and along with their mechanism, because they're always asking the mechanism and the name of the drug. So that is all I had to know. And we all know it is all about anti-obesity drugs or the IBD drugs. Only two topics they test. So I made a sort of a list for myself. Now, luckily or unluckily, they did not ask a drug question this time. But
This
then
time.
it gave me confidence that if I'll be able to answer this question, then it's okay. If I can't answer this question after reading this much, I was pretty sure that nobody in this exam can answer this question. And that is what, competitive exam is all about, that you have to take edge over the other, rather than, knowing about the whole field. So this would be, sir, my second point. And third point would be, which is the most, stressed upon point, but all the, people, revise as much as you can. Don't spread your syllabus too much. It is, the field of gastroenterology is too big. We cannot finish it off. We are not supposed to finish it off. We are just supposed to know the basics and some updates. Yes, you should refer to some of the articles, some of the AGA, ACG articles, for your better understanding. But while reading those articles, do not read the full articles. Read the recommendations, read their flow charts. And, if you do not understand something, then you can go through why they are recommending that or something like that. Especially, for IBD, pancreatitis, GI bleeds. So gastric varicose bleed, which is, recent hot topic, I felt for the exam. They're asking in interviews, they're asking in theory also. So for those topics, yes, select some topics, go through some guidelines, don't spend too much time on it. But yes, have a quick glance at it. Like, all the guidelines probably have first 2 pages of recommendations summary. Just go through that. Whatever you don't understand, go through the details of it. If you read a topic in your notes, none of the note, nothing can be 100% for you. So if there's a topic you feel you're not confident, then you can, go through the article, or guideline. For example, I was reading through metabolic dysfunction related liver diseases. So they have a beautiful article, and there is no other resource which can cover it as well as they've done in the article. It is hardly a few pages. Just read the recommendation boxes, read the flowchart, and, it's done. You don't need to do anything extra. So, sir, that would be, I think, all I have, sir.
Great. Thank you, Navsheen. You have in nutshell told so much data for students on a small time frame how to be very effective. And many students still feel I have to know everything, and they take some years to reach some level. Now that's not required, because learning is lifelong. Even now, after 5 years of my DM, still I'm learning. There's enough to learn, and lifelong learners we are. So it's just about, you can't aim to learn everything for your entrance, right? Entrance is basics plus updates. That's it. That's in nutshell what even I would want to tell
Yes,
all
sir.
you guys. So thank you, Navsheen. Hope we'll all meet again. Welcome to the club of gastroenterologists. Really
Thank you
proud
so
of
much,
you.
sir.
And we'll keep in touch. And
Sure,
of
sir.
course, you be in our WhatsApp group. There are a lot of students who will be benefited by presence, just the mere
Anytime, sir.
presence. Yes, of course, there are a lot of seniors also, juniors also. I know how busy you guys will be for over next 1.5 years, 2 years, thesis, this, that, everything. But all the best for you. Okay, from our side. Congratulations once again.
Thanks a lot, sir. Thanks to you and your team, sir, for getting me
My
here, sir. Thanks
Our
a lot,
pleasure.
sir.
Our pleasure. Thank you. Bye bye.
Bye, sir.
Thank you.